This is a presentation on creating a project plan to implement an electronic health record system through the help of Microsoft Project. The goal of this project is to improve the quality of service through the implementation of an electronic health record system, including extensive training for the staff. Through this system, we hope to reduce medical errors and enhance customer service. We utilized the Microsoft Project program to plan our project and decided our start date to be Monday, February 23rd, 2009. The program helped us estimate the duration of this project to be about 238 days and projected that the end date would be on Wednesday, January 10th, 2010. The Microsoft Project program has allowed us to construct a plan for implementation that can be easily managed and is flexible in order to take into considerations such as a task that has to be completed earlier or later than scheduled. These activities include patient information management, clinical information system, laboratory, pharmacy, radiology, imaging, and nutrition and food service. In this implementation, certain tasks must be completed in order for others to begin. This plan takes account for each task's predecessors and automatically assigns the logical start and end times. In some of these activities, configuration is followed by training. Training cannot start earlier than the day following the completion of configuration. However, the next activity can start as soon as the previous activity's configuration is completed, with no need in waiting for the activity's training to be completed. Some tasks and subtasks are also configured simultaneously. Here is an example of a sample subtask. As soon as the tasks under patient information management were completed, we were able to start with the laboratory task. Under the major laboratory task, there are 3 subtasks, including anatomic pathology, microbiology, and chemistry. In order for the 2-day training of chemistry to take place, a 10-day configuration had to be completed. After chemistry configuration was completed, the 10-day microbiology configuration was able to proceed simultaneously with the training of the chemistry staff. After the completion of the microbiology configuration, a 5-day training for this department was able to proceed simultaneously with the 10-day configuration of the anatomic pathology department. After this was completed, 5-day training was able to begin simultaneously with the configuration of the first task under the next department, which happened to be the pharmacy department. Microsoft Project is an amazing planning tool that has helped by organizing, calculating, and keeping track of start and stop times, as well as durations, predecessors, and scheduling needs. As mentioned earlier, this program's plan is flexible enough to account for easy updates in the schedule if there are changes to be made during the middle of the process. For example, if a task is completed earlier, subsequent tasks are automatically moved to earlier dates while retaining their original dates and dependencies. With a variety of different views made available, it allowed easy ways to visualize and manage all the activities before actually beginning the implementation of the electronic health records. Lastly, this program is great in facilitating planning processes because of its ability to be shared amongst all its stakeholders and allowing for great communication